Hello dost. All of you know, like 8th March is the International Women's Day. But do you think health is a one-day fling or it should be celebrated throughout lifelong? Women's health, often misunderstood and underplayed, has crucial importance not only in shaping the families but also shaping the nation as well. As our tradition says, Janani Janmabhumishta Sargadopi Garyeshi. Our mothers, our daughters, our wives, our girlfriends, and whatnot, women plays a multifaceted role, but when it comes to their health, they are often overlooked. Serious problems like UTI, even more severe breast carcinoma, cervical carcinoma has been reported around 3.4 lakh cases are there in India as per National Cancer Registry. UTI worldwide holds around 50% of the women, and these women are suffering once in a lifetime throughout urinary tract infection. Not only this, breast cancer in India has reported in 2022 highest number of deaths. What are these facts, dosto? So with this, we would like to take the International Women's Day as a pledge where we will take care of our women in a better way and raise awareness on these pressing issues so that we could educate the women around us, our beloved partners, and also any woman, any ladies you know suffering from this can get the most benefit out of it by watching our podcast. So for this, I have on my show Dr. Antara Roy to educate us and also give us some tips and tricks how to get rid of all these problems. Welcome, Doc, to our show.
Thank you, Molly, for having me here.
Yeah, thank you so much for giving us time. We are greatly privileged to know something very deep, interesting podcast and looking forward to learning like what are the common women health issues nowadays. So with this, I would like to ask you the first question that many of our women listeners might want to know, like what is UTI? Everybody else talks about UTI and people might have been suffering but they don't know. Please let us know.
Yes, UTI is known as the urinary tract infection involving the urinary bladder, kidney, ureter, and urethral meatus.
Okay.
So in UTI, females are mostly affected among females and males, and we know that the reproductive age group in the females is the most prone age group to have UTI.
Okay, and why is it so that females are more prone than men?
Yes, because females have short urethra. This is one of the reasons of causing UTI, and another reason is close proximity of the urethral meatus to the anus in case of females. So these are the two reasons which are occurring in females. That's why females are more prone to UTI than the male.
Yeah, and what are the most common responsible organisms that you see in your case studies like causing the UTI infection?
Yes, so among organisms, bacteria are the most common organism which are causing the urinary tract infection. So among the bacteria, Escherichia coli, Klebsiella pneumoniae, Proteus, Pseudomonas are the most common bacteria causing the urinary tract infection, and sometimes the fungi can also cause UTI, like Candida can cause.
Okay.
And among the parasites like Trichomonas vaginalis can cause the urinary tract infection, and some viruses also can cause, like the PK virus, which can cause urinary tract infection.
How do they get to enter the urinary path of the female, I say?
Yes, because there is two routes. Okay, one is ascending route, another is descending route.
Okay.
So in ascending route, what happens in female or male patients also, we have to do instrumentation sometimes. Instrumentation means catheterization of the patients.
Okay.
So at that time, what happens, the normal endogenous flora that might enter into the urethral meatus. Okay, and they will colonize, the bacteria will colonize, and subsequently it will enter into the bladder causing cystitis, and it ascends up to the ureter causing urethritis, and subsequently to the kidney causing pyelonephritis. This is the ascending route. And in case of sexual intercourse also, so that is, as we know that females have short urethra, so there is more chance in during sexual intercourse also to get the normal flora from the urethral meatus. And there is another route, as I've mentioned, that is the descending route, that is occurring due to septicemia or bacteremia, means bloodstream infection.
Okay.
So that is a severe condition which occurs because from descending route, the kidney is the first organ to get affected. So in that case, acute pyelonephritis occurs in those patients. So subsequently, it will come down according to the anatomical structure, the kidney, ureter, then the urinary bladder. But the descending route is the severe form of route which causes UTI.
So we can say, like in common layman's tongue, like because of the other infections, like from outside, the ascending routes follows. Maybe it may be coitus, it may be other like unhygienic toilet use, or maybe any like even the undergarments are not clean or properly. Through this, the ascending route follows, and for descending routes, it has to be some infection in the blood. Okay, so both the aspects are need to be taken care of.
Definitely.
Yes. So what are the common signs and symptoms one should look for? Maybe a person or a woman or man may be silently suffering, but they don't know they are having UTI, and how they could understand this, and when is the right time to take medical attention?
Yes. As I have mentioned, the reproductive age group in the females are the most common age group, and in males the incidence decreases from the in the first year of life. The incidence among males and females is around 2 to 4%, but after first year of life the incidence decreases in case of males. Okay,
first year means
first year means first year of life means from birth till 10 years of age.
10 years of age. Okay,
it's quite similar among males and females, around 2 to 4%. Okay, but after that in males the incidence decreases, but in case of females the incidence increases. Okay, so what happens in males in later age group, in old age, due to prostate problem, there can be UTI, but mostly in females we get the UTI in reproductive age group with some symptoms like fever. There may be flank pain. So flank pain is known as lower back pain.
Lower back pain.
Okay. And if the kidney is involved, we can have flank pain. Means the lower back pain. Then there will be increased urinary urgency.
Okay. Frequent urination they might feel.
Frequent urination will be there. Then there will be dysuria, which is known as pain while micturating.
Oh yeah.
So that those are the signs and symptoms which can occur in a patient of UTI.
Any burning sensation or rashes like this?
Yes. There can be burning micturation also. As I've told, there will be pain and burning together also. So both rashes are not that much common. Sometimes due to wearing tight clothes or tight pants, rashes can occur, but these rashes are not a common symptom. Yes, we can look for the fever and burning micturation, urinary urgency, increase in frequency, and dysuria.
All these things, in spite of whatever lifestyle they've been following, these things might suddenly come up, and they should like think, okay, something is wrong in my system. Okay. And then when they feel like they should seek the medical attention, right?
Yes, at that time, if they find such symptoms and those symptoms are bothering them for quite a long time, so they should seek medical advice at that time.
With this, we'd like to know what are the diagnostic measures to detect UTI?
Yes, so once you get such symptoms, you should go and take advice of the medical practitioner, and he or she will advise you for urinary examination. So we have to give the urine sample. So there is a proper procedure also to give the sample. Like we have to give the early morning sample.
Empty stomach?
Yes.
Fasting is required?
No, not fasting. We are telling that early morning, the first urine, which has been voided. So that urine has to be given, and it has to be midstream. Means the first part of the urine has to be discarded, and we will take the mid part. And this is the sample for urinary examination. Then we can send the sample for urinary culture also. Okay, and after checking the urinary sample, we can look for pus cells. Pus cells are known as neutrophils. So those will be plenty in number, and we will go for the culture, urinary culture. So in culture, the bacteria which I have mentioned, like the E. coli, Klebsiella, Proteus, Pseudomonas, this grows in urinary culture, and sometimes Candida, the fungi. Yes, those grow in urinary culture.
So these things will be ruled out all by the doctor, and like this, the treatment options will be there.
And sometimes, like as I've mentioned about the acute pyelonephritis, if kidney is involved, then we have to go for ultrasonography also sometimes. Okay, so we have to look for whether the kidney parenchyma is involved or not, whether there is any kind of inflammation, hydronephrosis has occurred in the kidney or not. So we should go for ultrasonography also.
If the doctor feels like
Yes.
he or she will
Yes.
advise
Yes, yes.
otherwise these are the, we should say, like more severe symptoms
Yes.
or severe cases
Yes.
of UTI.
Yes, otherwise we can just give the urinary sample and we will go for the urinary culture to look out for the bacteria or the fungi, whatever is growing, and according to that we will prescribe the medication.
Okay. Any common timeline of getting recovery from UTI, or like showing up of signs and symptoms once they're affected, maybe ascending path or descending path, whatever? Any timeline?
Yes. Once you start the medication, like within 7 to 10 days, you can recover from the symptoms.
Okay. The person will get relief.
Yes, definitely.
Okay. So with this, we'd like to ask, what are the treatment options available for UTI?
Yes, treatments will be based on the urinary culture report. So if bacteria is grown, we have to prescribe antibacterial. If fungi is grown, antifungal.
Yeah.
And if no bacteria or fungi is grown, we have to suspect for the viruses also. For parasites also, parasite can we can detect in direct examination. So from that we will, according to the organism, we will decide the treatment options.
Yes. So dosto, as you have listened from doc that there are many multiple causes of UTI. So it's best you consult your doctor or physician nearby and don't take antibiotics and here and there any pills like on your own. This is for your own safety.
Yes, because like nowadays we are seeing there is over the counter sale of antibiotics.
Yeah.
So they will not, people will not go to the this physician and they will just buy from the pharmacy shops.
Yes.
And that will rise to multi-drug resistant bacteria. So which is a greater concern these days.
These days, yes. Even this problem is found out in young children also.
Yes, definitely.
So this is one of the raising concern. Yes. So with this, everyone would like to ask you, and I'm asking you on their behalf, like what are the preventive steps to UTI? How one can prevent it?
Yes, we should take plenty of water. To stay hydrated is necessary in case of UTI. Why? Because if we drink plenty of water, it will flush out the bacteria. Okay. Next, we can avoid wearing tight clothes, tight pants, and then we have to clean the area of the urethral meatus after voiding of urine. And how to wipe that? That has to be wiped from front to the back. Not from the back to the front, because in the back side there is anal region where we harbor E. coli, that is Escherichia coli. So it might come in the front and it will again cause that ascending route of infection. So that's why we have to clean the area after voiding from front to back.
Front to back means cleaning, keeping your whatever genital hygiene is very important. Wearing like neat and clean clothes, and I think cotton clothes would be preferable to like for this. And also the summer days are coming, so take care of your hydration. That's very crucial. And does diet and nutrition or any such foods to prevent this, are there any, or
there is no such specific criteria as a people can drink coconut water to stay hydrated. So that's what I will just say, that just stay hydrated, maintain your hygiene so that we can prevent the UTI.
Yes. Okay. With this, we'd like to ask on another important topic, that is breast cancer. This has caused havoc all over globally, and millions of mothers, girls are like under this wrap. So for this, I would ask Doc, like what are the carcinomas present in female mostly?
Yes. So nowadays we are seeing that breast cancer and the cervical cancer are the most common carcinomas which are we come across among the females. So among the breast carcinoma, so the things we will look for in breast carcinoma are like there will be nipple discharges.
Okay. Symptoms like one should understand how.
Yes, there might be some lump in the breast.
Could you just mention the color of the nipple discharge? It should be like milky white?
Yeah, could be white, could be yellowish, could be blackish also. Sometimes greenish discharge also. Okay. So it might be of any color, but there will be some nipple discharges. Some breast lump will be there. You can feel the lumps.
Whenever they like go to the bathroom, they could watch for self physical examination.
Yes, that is a very important step for the females. Once every week, they should examine their breasts. While bathing, they can use their palm the area of the pump they can use, and there are 4 quadrants. So every quadrant they have to check whether there is any lump, there is any puckering of the skin,
like skin coming out.
Yes, some irregular changes in the skin. Okay, and then as I mentioned, nipple discharges, then inverted nipples. Okay, so those things they should look for.
Are any pain associated with this?
Yes, sometimes pain can also occur. There can be redness also. Pain and redness both can occur. Yes, other than whatever I have mentioned before, they should look for all those.
Okay, one common question, like me as a woman I'd like to ask you, because in some cases it is seen that there is tenderness and pain in breast just before the menses, like before periods there are maybe sign of PMS symptoms. So how can a woman distinguish that it's just a PMS symptom or it might be a sign of carcinoma?
Yes, that tenderness or means pain in the breast, it will go off like after like 2 to 3 days of this menstruation cycle. Yes, but this carcinoma of breast, these symptoms will recur again and again. And sometimes other than the carcinoma, we can also suspect for breast abscess. Sometimes this pain and redness occurs in breast abscess also. So for
like fluid collection, in the breast.
Collection of fluid can occur. That's why I'm telling we can go for physical examination, and if we suspect all these things, we can consult a physician for that.
Okay, so with this, what are the diagnostic measures to detect breast cancer specifically? I would like to ask.
Yeah, you should visit a physician, and after that there will be physical examination of your breast, and physician will suggest you mammography, which is an X-ray of the breast. We can also do ultrasonography, and if there is a breast lump or if there is any swelling in the axillary lymph node or any regional lymph node, we can go for biopsy sample, and we can also go for FNAC.
FNAC,
yes, like fine needle aspiration cytology. Okay, so here we will insert a needle, we'll take up some tissues, and we will look for the cells. So the tumor cells will be different for them. So that's how we diagnose it.
Yeah, that's how the medical team will diagnose, and they will let you know. Okay. So are there any such specific diagnostic tool for early detection, or just like you have said, like mammogram and everything, these are the only techniques?
Yes, early detection is by ourselves only. Females have to check every week. They have to do their physical examination. That is the source of early diagnosis. Otherwise, we cannot go for mammogram every time. We cannot go for mammogram monthly also, right? So that's how, if there is any changes in the breast, we should consult a physician
first. Yes. Any sort of abnormalities you feel like in your body, anything, any lumps, any tenderness apart from your PMS symptoms, you should like consult your physician at the earliest. So with this, what are the treatment options available in modern medical science?
Yes, treatment options, like we can give some estrogen modulators, and if a person suffers from breast carcinoma, they have to go for chemotherapy, radiotherapy, and some surgical procedure has to be done for mastectomy. Like we have to remove the breast also sometimes. If one breast is affected, it might affect the another one also. Yes, so that's why we have to go for mastectomy in those cases. So these are the treatment options available.
If not taken care of, can it turn to like spreading the cancer into other organs, to the lymphatic fluid?
Yes. If we are ignoring the case, then it can, as I mentioned, in some cases there is regional lymphadenopathy, like cervical lymph nodes or axillary lymph nodes are being enlarged. This might spread to other organs also. Okay, and this is known as metastasis. Yes, so metastasis can occur, and subsequently other organs, if it is involved, then it's very difficult for that person to survive. Because
it gives the case stage 4, I think stage 4 of cancer, from where survival rate reduces.
Very rare. So early detection is very necessary in case of breast carcinoma.
Okay. So with this another carcinoma, like commonly prevalent, that is cervical carcinoma. So what is cervical carcinoma and what causes it? We commonly heard many of the times, even the vaccines has come up for HPV, like, so could you like explain us?
Yes, cervical carcinoma is mostly caused by HPV, that is the human papilloma virus, which is a DNA virus. So we have seen that in our cervix, a normal microbial flora, that is lactobacillus, is present. Okay, that's microbiome. So what happens? It maintains the acidic pH, okay, of our vagina and cervix. But sometimes what happens, we see that this pH balance has been gone. There is dysbiosis. Okay, dysbiosis occurs, means the normal flora, that is lactobacillus, will reduce in number, and sometimes pathogenic bacteria increases in number. Okay. So what happens? This pathogenic bacteria will release some toxins. Okay, and when it releases the toxins, it damages the DNA. Okay, and it leads to cancer. So this is the reason we should always look for some cervical symptoms also. Like in cervical carcinoma, we can have symptoms like vaginal discharges, okay, which are foul smelling in nature. Sometimes we can see there is bleeding also from the vagina. And we can see in between the periods, the menstrual cycle, there will be irregular bleeding. Intermittent bleeding. Yes, yes. Suppose there is a 28 days of gap in between the two menstrual cycle, but we will see that on the 14th day there is again bleeding is there. Okay, so
bleeding or spotting or maybe
yes, some like dark colored blood is also coming out, not fresh blood also.
Not fresh blood.
Yes. So
reddish, dark red, brown, like this type of
and
thing.
some foul smelling discharges are coming out, and sometimes there is some lesion also in the cervix. Some lesions are also seen. So those are the alarming signs for cervical carcinoma.
Will there be any pain, or it may be painless, and the lady might not want know?
Yes. In some cases, there are we have seen that the cases are asymptomatic also. Okay. But that's why it's very necessary for the reproductive age group females. And till 45 years, we can go for pap smear examination. Okay. So here, what is pap smear is that we have to collect a sample from our cervix and we have to examine it. Okay. So from those examination, we can get some cancerous cells. Okay. So if we do it regularly at an interval of 3 months, okay, every 3 months, if the females get their pap smear done, checked, so that is a condition where we can get rid of this cervical carcinoma.
This examination has to be done under a gynec, and they should make a schedule like where they should do timely visits with their gynec to rule out all these causes of like breast cancer, maybe breast cancer, maybe it's cervical carcinoma or UTI. So as you've explained how the vaginal and cervical microbiome like plays the role in cervical carcinoma, so any particular microbiome or something causing the likelihood of this HPV virus like leading to infection? Any particular group or?
There is no such particular group. We can say that some pathogenic bacteria like Escherichia coli, Pseudomonas. So this can disbalance the microbiome of the vaginal flora. Yes. So that's how the lactobacilli decreases in number and the number of pathogenic bacteria increases. So there is no such particular that if this occurs, then cervical carcinoma can occur. There is no such thing. But we have to look for the pathogenic bacteria which causes the disbalance.
Yes. Okay. Nowadays, this is I'm asking for my personal interest. Like as you've said, the pH of our vaginal flora has to be like slightly acidic, so that more pathogens do not enter and make the colony over there. So many products, vaginal products, has come up in the market, you know, like maybe some are organic, some claim organic, some claim they may be chemical based, whatever. So is it advisable to use it like more often? This I'm asking, this is a very intimate question, but still I'm asking as you are a doc, like to aware our public what needs to be done. Like people going for an intimate routine, they tend to use such product, maybe chemical based, maybe organic based, whatever it is. It advisable to use it on a regular basis?
No, I don't think it is advisable because we don't know the exact composition. Okay, sometimes harmful chemicals can be added in those. So I don't think randomly you can choose. You can take advice from the gynecologist for that, which nowadays vaginal washes are coming out. So you can take the advice, particularly which one to get to use it, and otherwise random we cannot just select from the pharmacy and just use it.
Yes, because this will disturb the pH
Yes.
balance, and
Yes.
this will in turn aggravate more
Yes.
prone, make it prone.
Yes.
The female may be prone to
Yes.
such problems. Yes, that was I wanted to know. On a regular basis, people can use water only just for keeping the
Yes.
normal genital
Yes,
hygiene, I think.
Yes, they can
Yes.
just use water, and they can, as I have mentioned, they can wipe it
Wipe it off. Yeah.
wipe it off from front to
From
back.
front to back only.
Yes,
Remember?
not from the back to front.
Yes, because the anus part and
Yes.
the intimate area has to be kept
Yes.
like separate because
Yes.
of the different bacteria
Yes.
residing over there. So, what are the current diagnostic markers for cervical carcinoma? Already you have like mentioned pap smear. Any other test?
Yes, like we can do some HPV is again divided into some low risk groups and high risk groups. Okay, so for the low risk groups, we have some markers like 6 and 11. These are the name of the markers, and for the high risk groups, there are markers like 16, 18, 31, and 33. These are the markers, diagnostic tests which the person can do to identify the HPV infection.
Okay, and all this has to be done under lab
supervision
yes. Of a
Yes.
physician
Yes.
or gynec only.
Yes.
Yes. So, with this, what are the treatment options available?
Yes, treatments like again I have told we have to go for chemotherapy or radiation therapy for cervical carcinoma, but this cervical carcinoma is preventable. As you have mentioned earlier also, there is one vaccine.
One vaccine has come up. Yes, I've seen in news.
Yes, HPV vaccine is there, and there are two types, Gardasil and Cervarix. Okay, so this can be taken in the reproductive age group. Before if it is taken before reproductive age, it is it's very nice. If not taken also, like between the age of 9 to 45 years, it can be taken. Okay, and it can be taken in 2 to 3 doses can be given intramuscularly, and it's quite safe, and it can prevent cervical carcinoma.
The risk of getting it reduces.
Yes.
With this, thank you so much, doctor, for letting us know such insightful, knowledgeable conversation. So lastly, I would like to ask you, as a microbiologist, what are the recent researches going on in this microbiology field?
Yes, recent researches are going on the multi-drug resistant bacteria and their novel therapeutics, and some of the researches are going on the microbiome ecology also.
Okay, like how the different microbiome
affects affects the human body. Yes,
our immune system and everything. Okay, how nice. So look forward to you knowing such more interesting tips from you from future. And with this, I'd like to ask you on behalf of the listeners, what are the final piece of advice you want to give to all the women out there, not only women, maybe their husbands and everyone in the family, so that they could take care of the beloved?
Yes, definitely. I would like to say that you should have a balanced diet. Your hygiene should be maintained properly. You should eat healthy foods, and eat green leafy vegetables, eat seasonal fruits, and whatever is available around you, you can just have that. Don't go into fast foods, and you should maintain a healthy diet, and you should exercise regularly. That is a very important thing, and like Mole is doing a very good job, so you can join the yoga sessions, the holistic approach, whatever she is doing, it's very good, and I would like to thank her also for starting everything whatever she is doing for the mankind.
Thank you so much. With this, we would like to close our session. Thank you.